So here I have my nail disorder board. I'm going to be explaining the nail disorders. So I'm going to start with, this one is onychoschizia, and it is the nail splitting into layers. Can be caused by irritation of chemicals, polish, or soap. It may be an injury, a loss of moisture in the nail. Treatment would be to avoid water, use oil, things of that nature. And down here, we have onychia, and this is nail inflammation. The matrix becomes inflamed. It can be caused by injury, bacteria, improper sanitation. This bacteria is harmful and should not be treated. We now have onychophosis, and this is the overgrowth of keratin caused by the environment the client is exposed to. Things like chemical, radioactivity, skin disease, and malignant cancer may also cause this disorder and should not be treated. Up here we have koilonychia. This is the surface of the nail is concave or flat and spoon shaped. It could be caused by a skin disorder. It could be hereditary, idiopathic. So that is koilonychia right there. The next one we have is onycholysis is right there, this one. And it's the loosening of the nail plate. It separates from the nail bed partially or completely. It can be caused by eczema, cirrhosis, fungus, prolonged immersion in water. Usually should not be treated. Keep going to eggshell. The next one we have here is onychotosis. This one is the nail begins to shed, may be caused by illness, infection, and should not be treated. Up here we have eggshell nails. They're thin, white, tend to separate from the nail bed, very flexible, and increase in translucence. It could be caused by a nutritional disturbance. And we have defluvium. This is the nail begins to separate from the nail bed. Could be hereditary or from diabetes, trauma, or general medical conditions and should not be treated. And this right here is onychocanosis, and it is blue nails. The nail bed becomes blue. It could be caused by poor circulation or heart problems, and you should probably refer your client to a physician. Up here we have onychocryptosis, and this is an ingrown nail. It's found on both fingers and toes. The nail grows into the flesh and may cause infection. This can be caused by failing to correct hangnails or the overcorrection of hangnails. Recommendation should be to let the nails grow out. If the nails are infected, you should not treat. Next one we have is Leukonychia. Right there. And it's a white nail. There's 3 kinds of this condition, partial, totalus, and striate. It causes white discoloration or spots, can be partial, complete, or stripes in the nail. This may be caused by minor trauma to the nail bed or the matrix, and the recommendation treatment is to let the spots grow out because it doesn't affect manicures or pedicures. Next we have yellow nails. These nails are smooth and thick. The rate of growth is very slow. This condition could be hereditary and should not be treated. Up here we have hemorrhaged or bruised nails. They may be bruised or bleed, can be caused by trauma or disease. Down here we have egg nails, and they're painful hangnails. They may develop an infection, splitting in a dry cuticle, or injury to the cuticle by tearing may cause this condition. The treatment should be to soak in oil and loosen the cuticle. Down here we have Tinea unguium, which is ringworm of the nail. This causes superficial infection of the skin surrounding the nail, is a fungus, and should not be treated. This one up here is pterygium, or overgrowth of the cuticle onto the nail plate. It could cover the nail plate completely. It could be systemic local trauma that caused this. If it's a minor case, an oil manicure is enough. In severe cases, you should refer client to a physician. Down here we have paronychia. This is inflammation around the nail, and it spreads rapidly with mild redness or swelling. It could be caused by fungus or cirrhosis, and should be referred to a physician. And this one here is Tinea pedis, and this is the foot infection, a fungus in the skin surrounding the nails, and feet should not be treated. And we'll just turn this around. And up here we have Melanechia. Their vertical lines or bands often described as nail moles, which are usually form in the nail matrix. See a physician if you suddenly see this change in the nail. It could say that you may have malignant melanoma. We'll go. So here we have onychoxis. It's an overgrowth or thickening of the nail. It may be a natural part of aging, or it could be caused by trauma and poor circulation. This one right here, onychotrophia, is also known as astrophy. It is described as the nail wasting away. The nail loses its shine, shrinks, and then falls off. It could be a result of damage to the nail or injury. Once a nail astrophies, the condition is not reversible. This one over here, onychographosis, is nail curvature. It's increased and enlarged. The nail becomes thicker and curves. This condition could be a result of inflammation and is sometimes called ram's horns. Over here we have onychophagy. And this term describes the nails as bitten. Nail biters make it difficult for nail technicians. They can be serviced, and you may offer services to help your clients stop biting their nails. Right here is onychorexis, and it refers to brittle nails that have lengthwise ridges. Can be caused by injuries to the finger, excessive use of cuticle softeners, nail polish removers, or rough filing. And nails may be treated with cuticle oil to soften. And here we have furrows, also known as corrosions. They are long ridges that run either lengthwise or across the nail. Some lengthwise ridges are normal in adults. These ridges increase with age and can also be caused by cirrhosis, poor circulation, or frostbite. Ridges that run across the nail are caused by high fevers, pregnancy, or measles. So this is the back of my nail board. And the front of my nail board. So that is my nail board presentation.